All right, let's get started. We're a few minutes behind. Thank you so much for being here at 5 p.m. for our last session. We know it's a long day, but we really appreciate you guys being here. So without further ado, I will introduce our first presenter. So our breakout session 3, we're tracing to transform. We're pleased to introduce Helena Solo-Gabriele, evaluation of sweeping and UV light treatment of street and sidewalk surfaces for the reduction of bacteria in stormwater runoff. Why don't you just come on up here? Thank you. Yes, please. Round of applause.
And thank you for being here. Thank you for sticking it out till 5 o'clock. And I'm going to talk about what I call the UV project. Again, we're going to look at street sweeping and UV light treatment of both streets and sidewalks to remove bacteria, Enterococci, in stormwater runoff. I'd like to acknowledge the many students that worked on this project. They all volunteered, and also the incredible support received from the city of Miami Beach. The site that we're looking at is in Biscayne Bay, and it faces the bay. It's a small waterway that is right off of Normandy Isles. It drains a large area. The area that's drained is about 81 acres, and it includes Parkview Island, and then the majority, a larger area to the east. Why is this study important? Well, the kayak launch located within this canal has been closed since 2019 because of elevated levels of bacteria. The main source of contamination to the waterway is stormwater. It's the water that's coming off of the streets. It's coming from the street surfaces. Prior studies identified birds and sometimes dogs and humans as the major contributors. This work with the dogs, humans, and birds was done through microbial source tracking in collaboration with my collaborators, Dr. Senegaliano and Dr. Gidley, who are in the audience. And this work is now posted on the Miami Beach website, and we've published the very first project. We're still working on additional projects from this study. As a result of the elevated levels of microbes and the fact that it's coming from our surfaces, the city launched Operation Clean Water to address street-level pollution. It's a huge initiative. This is just one small part of that particular initiative. The study objectives for this small part of the clean water operation was first to evaluate the effectiveness of street sweeping. We looked at the large-scale sweepers, the industrial sweepers, and then also manual sweeping of the sidewalks through dustpans and brooms. And then we also looked at UV disinfection technology using what we call the sterilizer. It's a commercial product that is designed specifically to kill bacteria on yoga mats and on wrestling mats. So it's designed for indoor operation on very smooth surfaces. They retrofitted it for us so that we can use it on Miami Beach, which is a little bumpier to work on. We looked at street sweeping at the city scale. We've got numbers in terms of the total amount of street sweepings that are collected over the course of the year, the total street area that is swept. We also went into the street sweeper and pulled out the sweepings and analyzed that for bacteria levels. And based on all of those numbers, we were able to estimate that street sweeping removes about 63,000 bacteria, or most probable number, per square foot. And about 44,000 is removed from sidewalk, from simply sweeping the sidewalk with a broom. So based on this sweeping data, we have a huge number of bacteria that are removed per year. And we estimate that this is about a 4,300 reduction of bacteria per 100 mils for the values that are in the PVC. So sweeping physically removes a considerable amount of bacteria. Now with the UV treatment, we use 2 sterilizers. We used a large one, which is we pulled on the ground, and the other one was a handheld to get into the curb and gutters. And we applied it to the sidewalk in the streets. And there were the 3 segments identified, 3 locations within 73rd Street is where we focused our efforts. The 3 segments are segment A, B, and C shown there. Each segment was evaluated on each of 3 different days, September 19th, September 26th, and October 27th. And on each day, the different segments got different treatments, and we rotated those treatments around. The experimental setup required that we make it rain. So we had to put in sprinklers. We tapped into the hydrants. The hydrants had chlorinated water, so we had to dechlorinate the water with a big filter. It was a logistical activity, required a lot of effort. We pre-wetted the streets for 10 minutes, pre-wetted the sidewalks for 5 minutes, and then collected samples every 5 minutes for 5 times. And then we analyze the bacteria by IDEX. So this is water that's coming off of the street before it goes into the storm drain. Our results are shown here. The top graph corresponds to segment A. The middle graph corresponds to segment B. The third graph corresponds to segment C. And we have day 1, day 2, and day 3. And what you notice from all of those graphs, the dark blue are the streets, the bacteria that we measured on the streets. The light blue are the bacteria levels that we measured on this coming off of the sidewalks. As we proceeded, the numbers tended to go down from day 1 to day 2 to day 3, showing us that it was a repeated cleaning of the streets that helped reduce the bacteria levels. Now, our goal, you can see that the numbers there are really high. Our goal is to get the numbers down to acceptable levels of 70. That's the bathing water standard for recreational sites. And you can see that there's still a long way to go in order to get the bacteria down to the levels that are desired. Our baseline levels for the streets was 24,800 bacteria per 100 mils. The sidewalk baseline was 12,000. The maximum for the sidewalks was over 240,000, meaning that we need to get a 99.99% reduction of the bacteria coming off the street. What we found is that sweeping and UV treatment was able to remove about 50% of bacteria. So it works, it helps, but it's 50%. And we found that when you do it repeatedly, we even get more reductions. So on the streets, by day 3, we were able to get a 4-fold reduction on the bacteria. That's a 75% reduction. On the sidewalks, we were able to get a 7-fold reduction, which was 85%. But again, we need 99.99% reduction. We only achieved 80% with this. So our recommendations are, street sweeping does remove a lot of material, a lot of bacteria. There is some refinements that can be done to the industrial street sweeping process. For example, at the corners, when the truck turns around, there can be some manual pickup there. Also, there's some cleaning underneath the gutters that can be done manually. But overall, that process needs to continue. We recommend the addition of sidewalk cleaning. The advantage of sidewalk cleaning is that you don't have to move cars. You don't have to disrupt the community. The sidewalks are accessible, and you can get access to those and be easily cleaned. We recommend UV technology development. The unit that we use is for smaller scale. It's not for the city scale. In order for UV technology to be more applicable, it needs to be re-engineered so that it can be applied easily for a larger area. And then we also recommend considering additional technologies. Again, we need 99.99%. The UV light is good. It can penetrate. It hits the areas that the light hits. But the streets are very grooved and have a lot of inundations, and the light doesn't get to everywhere. So we recommend considering gases or even liquid disinfectants, perhaps hydrogen peroxide and or ozone. So our final takeaways are that stormwater contamination at the PVC is driven by the surfaces, the contamination of the street surfaces, the sidewalk surfaces. We think that sidewalks are a good opportunity to further reduce the sources beyond the street sweeping, focus also on the sidewalks. UV showed potential, but it needs to be scaled up to a larger city scale. We found that repeated cleaning over and over again, provided the best improvements. We saw an 80% reduction through repeated cleaning, but we need 99.9%. So in order to get to the 99.9%, we believe that we're going to get some additional help from the stormwater outfall trash and sediment collectors that they are in the process of installing. So there'll be some additional help there. Again, adding the sidewalk sweeping will help and enhance the street sweeping process. We recommend consideration of stronger disinfectants for streets and the sidewalks, although these stronger disinfectants may have some regulatory challenges with them. And we also recommend evaluating treating the canal water itself. So the surface is one thing, but also the water within the canal. There's a potential for possibly implementing nanobubbles with a disinfectant such as ozone. Again, there may be some regulatory challenges with that. And with that, I'd like to again thank the City of Miami Beach for the incredible help. The logistics on this project were very complicated, especially with the traffic. Again, very grateful to all the assistance that we received, and also thanking the community partners and the student volunteers. And with that, if we have time for questions.
Yeah.
Okay, perfect.